Below, I present compelling evidence and conjectures to argue that deregulation in fact poses less liability for both the government and the public. Government perspective, deregulation reduces long-term liability. The analysis that conclude deregulation would result in a loss of control and potential public backlash, increasing government liability. This perspective is short-sighted and fails to recognize the burdens imposed by the current regulated system. Deregulation shifts responsibility to the market, ultimately reducing the government's exposure. Administrative and political costs of revisions. Maintaining the 7th schedule requires the government to periodically revise fees, a process that consumes significant administrative resources and political capital and political vote bank liability. Each revision involves research, stakeholder negotiations and enforcement, costs that deregulation eliminates. Moreover, fee increases under government oversight are often politicized, with the public blaming the state for rising healthcare costs. For instance, the 2013 fee revision sparked widespread criticism despite being justified by inflation. Deregulation removes the government from this no-win situation, allowing market forces to determine prices. While short-term criticism of deregulation may occur, as seen in the 2019 debate, this is outweighed by the long-term benefit of shedding the ongoing liability of fee setting. The government's capacity to set appropriate fee caps is limited by Malaysia's diverse healthcare landscape, where costs and demand vary widely between urban and rural areas. A standardized fee schedule, even with periodic adjustments, risks mispricing, either undercompensating general practitioners in high-cost regions or overcharging patients in low-demand areas. Deregulation allows prices to align with local conditions, reducing the liability of government-induced market inefficiencies. For example, in competitive urban centers like Kuala Lumpur, market-driven pricing could lower fees, while in underserved rural areas, higher fees could attract more practitioners. Fostering innovation and efficiency. Under the 7th schedule's rigid fee caps, general practitioners lack incentives to innovate or adopt cost-saving measures as their revenue is fixed. Deregulation encourages new service models, such as telemedicine, group consultations, or subscription-based care, that can reduce costs and improve access. This benefits the government by alleviating pressure on the overburdened public healthcare system, a persistent challenge in Malaysia. By fostering a more efficient private sector, deregulation reduces the state's long-term liability for healthcare provision. Public perspective, deregulation enhances affordability and access. The analysis warns that deregulation would lead to higher, less predictable costs for the public. This overlooks the potential benefits of market-driven efficiencies and the shortcomings of the current system under periodic revisions. Competition as a cost control mechanism. Malaysia has over 7,000 private GP clinics, a competitive landscape that deregulation can leverage. In urban areas with high clinic density, such as Penang or Johor Bahru, GPs would need to compete on price and quality, potentially driving fees below current regulated levels. Even in less competitive regions, the absence of fee caps could attract new entrants, preventing excessive pricing. The analysis's fear of unchecked cost increases ignores this self-regulating nature of competitive markets. Broader pricing options for consumers. The 7th schedule enforces uniform fees, limiting affordability options for patients. Deregulation enables GPs to offer tiered services such as low-cost consultations for basic care or discounted telemedicine visits, catering to diverse income levels. In Singapore, where private healthcare pricing is largely deregulated, clinics provide a range of options, from budget-friendly to premium services. Malaysia could see similar benefits, improving access for lower-income patients who currently struggle with standardized fees. Flaws of periodic revisions. The analysis downplays how periodic revisions also raise costs for the public. The 2013 revision, for example, increased consultation fees by up to 14%, directly affecting patients without necessarily improving service quality. These government-mandated hikes often fail to reflect local market conditions, resulting in inefficiencies. Deregulation offers a more responsive alternative, allowing prices to adjust dynamically to supply and demand, rather than relying on periodic blanket increases. Malaysian context. Deregulation aligns with healthcare realities. Malaysia's healthcare system faces unique challenges, an overburdened public sector and growing reliance on private GPs, that deregulation is better equipped to address than periodic revisions. Addressing GP shortages. With public facilities stretched thin, many Malaysians turn to private GPs for timely care. However, GP distribution is uneven, with rural areas like East Malaysia suffering from shortages. Deregulation allows fees to rise in these underserved regions, incentivizing more GPs to practice there. This market-driven approach is more effective than government subsidies or mandates, which have failed to close rural healthcare gaps. Increased GP supply would enhance access, reducing public discontent and government liability. The analysis cites information asymmetry as a risk of deregulation, but this concern is outdated. Digital platforms like Doctor on Call and clinic review sites are improving price transparency, empowering patients to compare fees and services. In a deregulated market, these tools would help consumers make informed choices, mitigating the risk of price gouging. The government could amplify this benefit by promoting transparency initiatives, a lighter burden than enforcing fee caps. Evidence from deregulated markets. International examples bolster the case for deregulation. In Germany, deregulated GP fees have spurred competition and innovation without significant cost inflation. In Australia, private GP fees are market-driven yet remain manageable due to competition and transparency. Malaysia, with its growing digital infrastructure and competitive GP market, is well positioned to replicate these outcomes. The analysis's assertion that deregulation of GP fees poses greater liability for the government and public rests on flawed assumptions about market behavior and government efficacy. Periodic revisions under the 7th Schedule saddle the government with administrative, political and economic liabilities while failing to meet the diverse needs of Malaysia's healthcare system. Deregulation, by contrast, reduces the government's burden, harnesses competition, and fosters innovation, offering the public better access and potentially lower costs. The true liability lies in clinging to a rigid, government-controlled fee structure that stifles market dynamics and fails to adapt to Malaysia's evolving healthcare landscape.